good morning to you, to the audience that tunes in every morning to Abdiel and the rest of the team that makes this broadcast possible every morning. Regrettably, we begin our briefing today grieving the loss and conveying our condolences to the relatives of a deceased. We are talking about a 77-year-old female patient from the Cotorro municipality with the history of ischemic heart disease, chronic renal insufficiency, senile dementia, and chronic malnutrition. All these pathologies, after 17 days in admission and 4 days in the intensive care unit, starting on the 28th of May, she showed some respiratory complications, and she had a respiratory arrest yesterday, and she passed away despite all the efforts to revive her. We reiterate our condolences to her relatives. Until midnight last night, we were keeping in our hospitals 448 patients, one of the lowest figures we have had. We had one in surveillance, suspects 302, and confirmed 145. In primary healthcare observation, we have 1,617 people. Yesterday, more than 2,000 samples were studied for the detection of SARS-CoV-2 virus and COVID-19, 2015 samples. In the Pedro Curie Institute of Tropical Medicine, 786 samples were processed. In the Epidemiology and Microbiology Laboratory of Villa Clara, 368. In Santiago de Cuba, 281. In the Laboratory of Havana, 274. In the Ameiras Brothers Hospital, 193, and in the Biotechnology and Genetic Engineering Center Laboratory, 113 samples. As a result of the study of these 2015 samples, 20, that is 0.9%, tested positive for SARS-CoV-2 and COVID-19. And Cuba has already studied 103,123 samples, and of that study, 2,025, 2% have tested positive for COVID-19. The 20 confirmed cases yesterday all are Cuban, and all of them are contacts of confirmed cases. This is the risk group of greatest importance in our country, and I believe that in the rest of the world as well. We have a cumulative total of 1,775 people, 47% of the 2,025 people diagnosed with the disease that have acquired the disease from a contact with a person previously diagnosed with COVID-19. As the source of infection was determined in all cases yesterday, from previous days, there are 77 cases whose source of infection, 3.9%, has not been identified. The figure of 132 people whose source of infection has been abroad remains unchanged, 6.6% of all cases. 17 of the diagnosed cases are of the female sex, a sex that has been predominant in the last few days. In the cumulative total, 1,000 1,008 individuals are female, 49.8%, and 3 out of the 20 cases were male, accumulating 1,017 for 50.2%. 80%, that is 16 out of the 20 cases diagnosed yesterday, were asymptomatic. Thus, 51.1% in the cumulative total of all cases in the pandemic in Cuba have been asymptomatic when testing positive. We're talking about 1,036 people. The age groups most affected are the group of 40 to 60 years with 12 cases, 60%, followed by the group of under 40 years of age with 6 cases, 30%. Yesterday, there was one child diagnosed with the disease, an 8-year-old boy from Arroyo Naranjo municipality here in Havana, a positive case contact. And with this case, we have accumulated 225 children diagnosed with COVID-19 in our country, out of which 207 have been discharged. And as we always say, all of them have a satisfactory evolution with no complications. The 20 cases confirmed yesterday, all are from Havana, 100%. From Playa municipality, there are 8, 4 from Marianao, from Arroyo Naranjo, 3, and from Cerro, Centro Habana, 10 de Octubre, Habana del Este, and Aliza, 1 from each of these territories. 6 provinces and the special municipality of the Isle of Youth have not reported positive cases in the last 2 weeks. They are Santi Espíritus, Mayabeque, Holguín, Cienfuegos, Santiago de Cuba, Guantánamo, and as I said, the special municipality of the Isle of Youth. Of the 2,025 people who have been diagnosed with the disease in our country, 145 remain hospitalized. These are the confirmed, these are the active cases that we have in the country as of 12 midnight last night, and 97.9%, that is 142 of 145, have a favorable clinical evolution. As I said at the beginning of our briefing, we grieve the death of one patient today, and we have a cumulative total of 83 people who have died in Cuba as a result of this pandemic, which gives us a lethality rate of 4.09%. And Cuba remains in the 16th place among the countries of the region of the Americas in terms of the lethality rate. In our region, Mexico ranks on the first place with a rate of 11.11, Ecuador with 8.61, Canada with 7.77, Brazil with 6.10, and the United States with 5.9. I'm not including here the islands of the Caribbean. I always mention the 2 evacuees from the beginning of the pandemic, and yesterday 35 patients were discharged. Despite the fact that this is a high number of confirmed cases, and I say high because we already got used for several days to lower number of cases, although there were 20 cases confirmed today. However, the ratio between admission and discharges favors the latter. 35 discharges versus 20 confirmed cases. And of all the patients diagnosed, 1,795 people who have had COVID-19 in our country, 88.7% have recovered and have been released at this time. 3 patients remain in serious condition. These 3 patients are admitted in the Salvador Allende Hospital here in Havana, One of the patients who was reported in serious condition showed improvement and now is reported in guarded condition. And another patient from that same hospital had some complications and now is being reported in serious condition. This is the situation we have in Cuba in terms of the pandemic and the world. And this information, we really have to take it into consideration to assess the evolution of the pandemic. 185 countries remain reporting cases of COVID-19. In these 185 countries, 120,319 new cases were confirmed yesterday, for a cumulative total of 5,776,934 confirmed cases in the world. And yesterday, 4,734 people died in the world as a result of this disease, for a cumulative total of 360,089 deaths, for a lethality in the world of 6.23%. The region of the Americas, after diagnosing 67,663 cases yesterday, already accumulates 2,698,519 confirmed cases. In our region, 3,166 people died with this disease yesterday, totaling 155,764 fatalities, for a lethality of 5.77%. This is the situation in our country and in the world as of 12 o'clock last night.